some of the feelings I had at that point were like I felt lonely, I felt trapped, there's a bit of anxiety going on there, but mostly it was the feeling trapped and not knowing why I was feeling trapped. That was the most frustrating part of it. I started to notice different behaviours when I sort of I was, because what happened was I started to drink a lot more than what I was drinking before, and then I thought that wasn't working because it just made me even more depressed than what I was, and I kind of like thought that was the cure to it, but it wasn't. And then I decided to, because I was already a recreational drug user at the time, and then I thought, well, maybe I'll try, using drugs, and it spiraled me into a totally different. So many other bad behaviours started to come out of it. Like my drug intake increased, and the depression and the grief got worse, and so the more drugs I took, the worse it got. It was okay when I was high as a kite, but the minute I came down, the grief and the depression would intensify 10 times, and it just kept on going on like that. Other supports for me, apart from rehab, have been a community. How can I say it? I guess being more involved in my new community. When I was going through the mental health issues, I had a different community there, and it was the wrong community, and everything wasn't working for me. This time around, I'm in this recovery program, and I'm surrounded by all these other supports, like peer groups, like being around friends that have actually gone through the same thing that I have gone through, and to be able to talk to them about it. I'm a lot closer to my family now, because they just thought I was crazy, and with some of my family, I pushed them away because I didn't know what was happening with me. So, and all they were trying to do was help me, and all I was saying was mind your own business, and we've become further and further apart. I have my family closer to me now, and I'm able to talk about what's wrong with me now, thanks to the program that I'm in. Look, there is something I do on a regular basis, and that is I wake up and I'm thankful that I'm alive today, and that I have people around me in my life today that I can reach out to. I think for me that was one of the hardest things to do. I was so proud, and I always thought that I could do it on my own, and so reaching out was not an option. Now I realise that the issues that I went through, you can't do them on your own. So just knowing that I can reach out for help is a major transformation for me, and that's always there. What I would say to someone who is experiencing mental health issues would be to not to be afraid to reach out, because there is help there, and even if you think you can handle it, just still reach out anyway, because amazing things happen. And we don't know what they are. We just have to reach out and just know and trust that it'll be okay. That, like, my mental health issues have nothing to do with my gender at all, nothing at all. What I went through with my gender and the issues that I went through because of my gender were brought on by outside influences, okay, like society, putting me down because of who I was, or people making fun of me because of who I was, or saying, no, that you're not good enough to be that, That's what those issues were. They had nothing to do with my gender. They were all brought on from outside influences. My message to service providers and how to deal with a trans client who comes in presenting with mental health issues would be to treat the illness, not the gender, and that would be in their approach, and to be a little bit more sensitive and to not maybe ask them questions about their gender, because it's not their gender that's in question here, it's what's going on for them. So deal with the illness first and allow them to speak, and if you listen, the gender part will come in, and you'll know, you won't need to ask anything about the gender. It's a bit like when transgender clients access a service and the staff member or the person behind the counter doesn't know how to deal with this, and they go, some of them are quite insensitive and have done in the past and still do now, and they go, oh, okay. They look at your ID and they go, oh, hang on, but this is not you. You know, things like that. You know, whoever's presented in front of you, that's who it is. You know, don't worry about the ID or anything like that, and don't question their gender in front of everyone else. You know, take them to a quiet room and do it there. Be a little bit more sensitive, and yeah.